Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you back as I highlight a paper of particular interest to the readership by interviewing multiple authors of the paper from the article, which appeared in the August 2022 edition of the journal. Today's article I picked for more in-depth exposure is entitled Patient Power Empowerment Among Adults with Arthritis, the Case for Emotional Support by Carluzzo and colleagues. And today I'm pleased to speak to Kathleen Carluzzo, Dr. Erin Singh, Julie Eller, and Dr. Jasvinder Singh about this paper, about the importance of patient empowerment and factors that are associated with empowerment in adults with arthritis. I want to thank all four of you for joining me and taking the time to speak to our listeners. So let's begin. So the first question is, could you briefly outline for the readership what the important factors led you to actually study this issue?
Sure. And I'd also like to acknowledge Karen Schifferdecker and from our Center for Program Design and Evaluation at Dartmouth, and Kristen Muller from the Arthritis Foundation have joined us as well. And I'm grateful for the opportunity to speak with you and have all of these wonderful colleagues on board. So to outline the important factors that led us to this study, the decision to study patient empowerment was part of a larger initiative envisioned by the Arthritis Foundation nearly 5 years ago now. And so our co-authors, Eakin and Julie Eller and their colleagues at the foundation identified 3 areas that were in need of support and resources. And those were better physical health, better social emotional health, and improved experience of care in interactions with the healthcare providers. And patient empowerment is a big part of that. And so our team, the Center for Program Design and Evaluation at Dartmouth, was enlisted to help design and facilitate a process for engaging patients, providers, and other stakeholders in providing feedback on what is important in those areas. And so in multiple rounds of interviews, focus groups, and consensus building, really clarified how and what patient data are needed in those areas and should be measured, tracked, and used to improve health and healthcare interactions. And the product of all of that effort is what we call the Livvs Insights. And that's a program that continues to the date of this interview to longitudinally track patient-reported health outcomes and empowerment among adults living with arthritis. And that process was described in more detail in a paper that Karen Schifferdecker led in 2020 with several of other folks on this call. And at the heart of it, patient empowerment is important to this team because it's important to people with arthritis. And that's shown through in those interviews and focus groups that we held. And feeling empowered is critical for people with arthritis and other chronic illnesses for whom self-management is important for their health outcomes. In this study, we investigated elements that contribute to patients feeling empowered in their interactions with healthcare providers.
Okay, so with that, we'll move on to the second question. Could you please review who was studied, the time period, and how you identified the patients who you studied?
Sure. So this study included nearly 7,000 adults that were diagnosed with some form of arthritis who'd seen a healthcare provider for their arthritis in the past 6 months and completed surveys between March 2019, when this initiative began, and March 2020. And we chose to cut off the data at that time of the pandemic shutdowns because we didn't know quite what the impact might be on patients and their experiences in the healthcare setting. So fortunately, we had enough data to cut it off there. And the participants were recruited in a few ways, actively through the Arthritis Foundation's volunteer-driven community engagement network and through social media and email campaigns. And then also recruited passively through the foundation's website. There's a link on there that people could click on to participate.
Anything to add? Okay, move on. And for the non-informed, such as myself, how do you measure patient empowerment? I mean, I found it a fascinating paper because I learned a lot of patient empowerment. Maybe you can just explain the measurements, the principles, etc.
Sure. Now, because empowerment is complex and multifaceted, as I'm sure you have a better sense having gone through the literature, measure selection was very important in this process that I described earlier. And so my colleague Erin Knight-Zhang is going to provide a bit more detail on this. Is that all right if I hand it over to you, Erin?
Yeah, sure. So as Kathy mentioned, we started with an understanding that patient empowerment was multifaceted, and we prioritized a few things in selecting an instrument to measure this construct, including patient input, psychometric quality, and a focus on patient-driven factors rather than provider behaviors. And these goals aligned with a definition of patient empowerment that was put forth in a measure called the Healthcare Empowerment Questionnaire, which was developed in Canada by Gagnon and colleagues. And we selected this because patients felt it assessed a construct that was more valuable or important than what other measures that we identified assessed. And their definition really relates to a mechanism that leads to a patient increasing their control or involvement in processes that they find important. And we also found a concept analysis of patient empowerment that defined key attributes of this construct as the ability to affect change, self-determination, and ability for autonomy, and a process for obtaining self-management tools that enable their empowerment. So what that actually looks like on the HCEQ then is these 3 subskills, 2 of which we renamed. So patient information seeking, healthcare interaction results, and then degree of control. And after speaking with patients, we actually decided to remove degree of control just due to that feedback of it being actually less in their control given the context in the US. So our validation of the HCEQ was then later published in Health Expectations Journal. So patient information seeking assesses the extent to which the respondent asks questions or asks for explanations. And then healthcare interaction result is a little bit different in that it assesses their perspectives on how their provider actually responded. So for example, were their choices respected? Were they able to get their questions answered? And did they get the help that they needed? And then patients answer each of those questions on a 4-point Likert scale in 2 ways. So first, they're asked whether they felt something happened. So for instance, did you feel that your choices were respected? And then they're asked how important it was to them. So how important is it that your choices were respected? So you can see it really reflects those different definitions that I just spoke about. And I think just to tie this up, we've always been interested in the bidirectional nature of patient empowerment and in understanding patient behavior specifically to better impact and improve the patient's own experiences of their care and thus their outcomes, as Kathy alluded to earlier on. So even without direct access to providers. So in this way, I think we agree with the authors of the corresponding editorial actually that patient empowerment is a really nuanced construct and its measurement shouldn't just rely upon this idea that patients lack control and power unless it's given to them by providers. I think we also agree that more instruments should be developed and validated to assess patient empowerment in a very comprehensive way.
So as I understand it, then this really is a generic tool. It's not specific for arthritis, would be logical to me anyway. And that's what you're implying, just for the readership to know.
Yes, that's correct. It was developed in just in an elderly sample in Canada, and we revalidated it with our sample of patients with arthritis. That was really important to us, of course, to make sure that it actually was valid and reliable in this group of patients.
Right. Well, and Canadians and Americans, although sometimes we get confused in Europe, confuse us and mix us together. We do have differences, so it's nice to hear it was validated in another cohort.
Yes, absolutely.
I have to make comments like that. So, any other comments from the group? Okay. And would you like to go over the major findings of the study?
Sure. So this study really provides a comprehensive look at who in this population has lower versus higher empowerment. And we saw that lower empowerment was seen among those who were male, older, less educated, and who had lower income, and also those with osteoarthritis, less emotional support, or better physical function. And while all those factors were significant, most of them had a fairly small effect on empowerment. And so through hierarchical regression modeling, we were able to look at what the effect of each of those was. And we found that for both types of empowerment, those the patient information seeking and healthcare interaction results, that emotional support was really the most important factor among those that we measured. And emotional support, it's worth noting, was measured using the PROMIS emotional support short form. And that measure assesses the extent to which people feel that they have someone to talk to confide in, and someone who appreciates them. And so again, we're seeing that people who had this kind of emotional support reported feeling more empowered with both information seeking behavior and the healthcare interaction results in terms of getting their questions answered and getting the help that they needed.
You mentioned age, and I don't know how you broke that down. One of the things certainly that I look at all the time now and strikes me as being a pediatric oncologist now studying young adults. Did you notice as you got younger, you mentioned older people, that there was a change? So the people like say under 25, or was your cohort really too small to dissect it down to that level granularity?
Sure. So we actually saw a curvilinear relationship with age, so which we adjusted for. But in the end, it really was not a particularly strong, did not have a particularly strong signal, but it was slightly lower among older folks.
Okay, thank you. Any other comments before we move on? Okay. And following that question, what do you think is required now to improve empowerment? How should it be done, and where do we go next?
Sure. So I'm actually going to ask some other folks to speak to this, because I know that Dr. Singh and Julie and Kristen are much more close to patients with arthritis, and I'm interested to hear their feedback on this.
Sure. So to give my insights on this, I think that the focus, what's required for improvement, is almost based on what we experience as barriers through this study and also in practice. I believe that patient education, communication, and access could be three actionable avenues for improving patient empowerment in people with arthritis. And I'll just sort of dive into a little bit into each of those constructs. So improved access or access of patients to teams, and what I mean by that is access to providers and provider teams before, during, and after clinic visits. So there's many avenues where access is limited either by the healthcare insurance or the means that patients have. And you can certainly see that those in the margins of society, as well as by sex and race, ethnicity, and several other characteristics and sociodemographics, that certain parts of our patient population are disadvantaged. And certainly improving access potentially has a way to empower patient. Patient education, again, we have, COVID has taught us that there are tools other than just showing up at a physician visit physically that can help us, that can be a way to get care. So patient education can occur through electronic healthcare records. People who don't have access to transportation because of socioeconomic disadvantage can do telemedicine in some instances. And education can also occur through those sort of means. Arthritis Foundation has been at the forefront of bringing patient materials free of cost to patients through the newsletters, as well as communications, and also a lot through their website and printed materials. So having access to these materials, both in paper as well as electronically, perhaps through apps and other things, are ways to take away those barriers that exist in patient education inside and outside of healthcare visits that I really think can empower patients. The third aspect that I want to focus on a little bit is the communication. I think that access to communication and better communication between patients and healthcare teams can certainly empower patients in a big way. Things like patient navigators that are funded and covered by Medicaid in several states in the US and other parts of the world are a good way for patients to relate to a team of doctors who are busy and nurses who are busy through their navigators who are more easily accessible and can relate those messages and those questions from patients and issues from patients to healthcare teams. Better integration within the healthcare systems, having a pharmacist, having a pre-authorization drug approval person within the clinics and having patient direct access to them so that when a prescription is written and they have questions or it's in the process, the patient has ways to reach and be in control of the process and know where it sits in the entire process of being written to actually being received and then what to do with it. If they have questions about the injections or the pills that they get for their arthritis treatment, I think is, again, the ability to have an integrated healthcare at the control of their thumb or in their hand through a phone, whether it's through an app or through a phone call, I think is the other ways to do that. I think also using technology, so getting data from the patients ahead of the visit. What is bothering you the most in the last week? Is it the pain, or is it your payment for the drug, or is it support by a caregiver who is now sick? That's actually bearing on your mind. If that's the case, we should not be talking medication during that visit. So having that information ahead of time and then focusing their visit on what the patient needs at that visit and not what we are used to going through with the patient in that 15-minute visit, I think will empower patients. So using technology and tools, virtual, using phones that are smart and not smart, and a variety of other technology-based things through EHR, and using it to actually help the patient, not just help the billing and functioning of a healthcare provider side of it, but actually helping the patient side of it to give them as many tools and educate them about the access to those tools and help them in getting used to accessing those tools and having those on demand would actually help, I think, empower patients in the short and the long run. So those are my thoughts, and I welcome other thoughts as well.
I'll just share, as Dr. Singh alluded to, the Arthritis Foundation does really want to enable patient empowerment and does so through a comprehensive array of programming and services. And so we have three major areas of programming. There's science and research, advocacy and access, and really connection and empowerment. And I think that highlights how patient empowerment and emotional support really are top of mind for the foundation. The Livvs Insight Survey, which was the basis of this study, is really an important way that the Arthritis Foundation empowers patients. It was really designed as an opportunity for patients to share their lived experience of the disease. And that information helps the foundation to break down barriers of care. It informs our research agenda, as well as the programming and resources that we provide that really we hope make a difference in patients' lives. And so besides the results of this study, one of the major things that we've learned from the Insight Survey is the extent to which pain impacts the daily lives of patients. And so this informed our programming and led to the creation of resources like the VIM app, which is focused on pain management. It's also certainly informed our research agenda, both in rheumatoid arthritis and osteoarthritis. And it helps us decide really what topics to cover in our various educational resources that we provide. And it informs the programming that we offer to our Connect groups, which are social supportive groups that meet both in person and virtually. And so I think these community and peer-based supports can really enhance the emotional support for patients and build their information seeking skills, all of which empowers patients. And so I think I'll just stop there and turn it over to Julie Eller, who can speak more to this topic.
Yeah, thank you so much, Kristen, and thank you to everybody who has been a contributor to this program. I think the Livvs Insights program and the Livvs Arthritis Network has a real role to play for patients and how they understand their condition, understand the resources that are available to them, and the ways that they can navigate a very complex and difficult system. As a patient myself, I have participated as an Insights survey participant. I've completed the survey quite a few times and had an opportunity to participate in our programs of research and support. So I wanted to highlight a couple of the things that Dr. Singh had mentioned earlier that have been particularly impactful to me and many other patients with arthritis. The first is that the Arthritis Foundation is committed to being a data-driven and data-inspired network where we are actively responding to the feedback that we're receiving from patients through the Insights survey. And so as we mentioned earlier, one of the major headaches that patients have is this lack of control as a result of a system that sometimes feels broken. And the advocacy team is working actively on healthcare access issues that allow for greater time spent with providers in office, consistent telehealth contact, and even reductions in headaches like prior authorization or step therapy to really ensure that access to care is comprehensive and continuum. The data doesn't just inspire an advocacy agenda, but it also inspires our patient education, as Kristen had mentioned earlier, where some of the features that we had uncovered in the data, areas where patients maybe feel less empowered, some of those cohorts that we mentioned, the populations that we mentioned, that inspires the educational strategy where now we're developing and determining different products and inpatient engagement and inpatient education to direct specifically at males and older individuals and so on that are a direct reflection of the data in the survey. And I would be remiss to not bubble up some of the pieces on communication that Dr. Singh and Kristen had mentioned earlier. I think there are remarkable free resources from the Arthritis Foundation, including the Vim app, the podcast, the Live Yes with Arthritis podcast, the newsletters, the helpline. It's 24/7. There are so many resources that are available to encourage people to ask questions and have their questions answered so that they're not just learning about arthritis or about the healthcare system, but about how they can really maximize the access to care that they have and the ways that they can receive support. And all of that has an underbelly, not to continue and be too effusive, but all of that has an underbelly with the volunteer-driven support network. There are support groups across the country that patients can meet with other patients like them and ask questions about how they can engage in the healthcare system and in their doctor's offices. And all of those kind of lesson plans and access to care kind of inspiration moments are really driven by this survey and by this type of research. And we are constantly trying to learn from and put more resources out that reflect the direct needs of our patient population. And I think that that is a really inspiring thing. And so I'm hopeful that this is the first of many such articles about patient empowerment and how patients can really access the care that they need with tools and resources and support from organizations like the Arthritis Foundation.
Any other comments? Well, that was excellent. And so is there anything any one of the five of you felt that we missed that you'd just like to express in this theme that we're talking about?
So I'll speak up. So I think the main thing that we realized throughout our work with the foundation and the insight survey and so on is that patients live with arthritis all the time. And so this is not just in the healthcare center, it's not just in the home, it's in the work setting, it's in so many different places that their lives may be affected or that they feel empowered to take some action. And so I think that's what we try to speak about and think about when we think about empowerment and also emotional support, that it's across the spectrum. And that, so that's why it's important to think about both the healthcare setting, but also outside the healthcare setting where they actually spend most of their life, right? So that's why I think it's important to think about all the different ways empowerment gets realized. And I think the editorial that came with this certainly speaks to that, that it's not just about the interaction in the healthcare setting, it's about the lives that people need to live and how they experience that. So, so I think it's exciting research, and I think it's also hopefully contribute to knowledge about how to think about this in the future.
So I think one thing I'd like to just add on to what Karen just mentioned is, and Arthritis Foundation has really done a wonderful job at this through their communication with masses of people, is the focus not only just on pharmacological therapy, which we have wonderfully advanced for a lot of inflammatory arthritis, lupus, and other conditions, but also a focus of feeling empowered and integrating mind-body interventions, realizing the true importance of exercise, moving, with the campaigns that Arthritis Foundation has had, clarification about food and other, how people handle their food, and food portions, and paying attention to those sort of things, body mass index, weight, and other things, and even learning how to, what aspects to tackle. So really bringing forth the importance of the non-pharmacologic, both sort of things like exercise, weight loss, diet, but also mind-body interventions, behavioral intervention, and things that patients can have access to and or practice themselves that can really enhance or sometimes fill the gap left by ineffective pharmacological interventions. I do think that a lot more work needs to be done by all of us, and Arthritis Foundation, other organizations are in lead, but healthcare systems can certainly collaborate with the volunteer organizations like AF and others. We need to really bring forth that aspect of empowerment and bringing out tools, how to get exercise, how to really use, exercise is what patients are told by physicians all the time. That's not what patients want to hear. What patient wants to hear is in my case, with my limitations, where I live and what I have access to, which exercise and what place and how often and how do I get there? And we really need an integration of volunteer organizations, healthcare systems, and in organizations that work in the society to help people from all walks of life, to enable them to get there. And I know as a physician, I'm putting a lot more emphasis on non-pharmacological interventions, but I truly believe with osteoarthritis and some of our other conditions having such a big burden on the patients, we really, pharma companies do a great job of getting things out of patients. We need to bring out the non-pharma aspect and things that patients can really have tools to access and incorporate that into their empowerment and taking control of their diseases and their bodies and their lives.
Thank you. Any other comments? Well, I certainly learned a lot, both by reading the paper and the editorial, as well as listening to this podcast. I really want to thank you for taking the time to give our listeners, I'm sure for most of them, as it was for me, significantly new insights into patient empowerment in patients with arthritis. And I ask our viewers and listeners to please read the article, Patient Empowerment Among Adults with Arthritis, the Case for Emotional Support. And as alluded to today, there's an accompanying editorial by Drs. Manrique de Lara and Palez Balestas from the Hospital General de Mexico de Eduardo Lasega. I'm terrible with other languages, Mexico City, and it's entitled Beyond Empowerment in Rheumatology Care. And these are now available at our website at jroom.org. And we'd love to hear any comments on Twitter at jroom or email manuscripts@dayroom.com. And I want to thank you all. I guess now we're up to 6 people from the paper and otherwise for joining in this podcast. And I want to thank listeners for listening to it, and hope everybody will listen next week, next month, when I speak to the author of another article of interest, which will appear in the September 2022 edition. Thank you all.
Thank you.
Thank you.
Thank you.